really just, you know, space fan. I don't know what. The second trimester. So they live in here, and they have a maternal component if you would like to use it. We just usually use them like this, but you certainly can. And what's in there is this creepy thing. And when you guys are scanning, so this is exactly what's in here. So it may be helpful, like, okay, you know, heads up or heads down. It may be helpful to position this with what this is doing, just so you're like, okay, I need to go this way. Okay, now I'm going this way, you know, so you can kind of visualize it a little bit better. And then they all come in this really weird cervix uterus thing. I don't know what it is. But anyway, when you're done with these guys, they can go back in their womb. And then these, just soap and water, you can dry them. And you can even, since we're all going to be using fairly frequently, you can just leave them on the counter on a paper towel if you want, instead of like having to go into the suitcases all the time. That's just fine with me. All right, so let's start our patient data. Running space, tell you, okay, I gotta do that. So we'll do biometry. We're gonna do an OB ultrasound. So same thing. With our second tries or first tries, we are more likely to have an LMP. With the BPPs and some of the second tries, we're more likely to have a due date. And I'll have to note on my worksheet, and there's a little spot for it, you know, gestational age and due date, and is it based on provider notes, based on patient data, or based on LMP? So I can check which one it is on the worksheet. But in this case, we'll just put in my birthday. 7/12. Well, you are hilarious. So we were looking at the sheet where everybody puts their birthday. You put your birthday of this year. So my birthday is a few years ago, but July 12th. All your patient cards that you've ever used have my birthday. And when you guys start making your patient cards for next week's, it's really easy to just use your own birthday and add or subtract 5 or 10 years than trying to figure out like, oh, she was born in April and it was April 4th, but tomorrow's going to be April 7th. You know what I mean? Just use your own birthday and then just add or subtract the many years you want. At this point, if we knew that she had twins, we would put twins in here, and then that will give us the opportunity to measure 2 sets of biometry or 2 sets of everything, and then it will have the worksheet and they'll be separated. Instead of having to go like which one was which, you know, who was where, so it will give us that opportunity. If we don't know she's pregnant, we put our probe down, you can always come back here and change that. And then of course our gravidipara, we talked all about that business. All right, so let's get started. So, we want to make sure we're on OB general. And these things can be a little bit difficult to scan. Did I bring gel? Oh, yeah, okay. I usually have to like keep my hand on them. You won't have that problem out in the real world with women. They're really hard to push into. And out in the real world, you're gonna have, like you guys push into each other, right? You know, it's easier than pushing into these. And you'll be able to, like say I need a different plane, you'll be able to use mom quite a bit more, whereas these have that rim. So it makes it a little bit harder when you're trying to elongate structures. So this rim can be kind of trouble. But keep in mind, out in the real world, mom is squishable. And these are nice because you can flip them either way. So today he looks like this, you flip him over, now he looks like this, and so you can kind of practice different versions of. Yeah, you can see I deal with kids really well. All right, so let's see what we're dealing with here.
And so far, I met just boys. Do we have girls? Eggs? No.
These are they boys? Yeah, I guess they are. I didn't realize. So that's the other thing too. Like the parents really care about gender. Radiologists do not care unless there's some sort of abnormality associated with it. So there's not. I don't even think there's a spot on my worksheet for gender. Yeah. So nobody cares. Okay, let's get this guy going. Okay.
Sorry.
All right, so we're actually down. So baby is, so this is urinary bladder, and was it you asking me? So these would be like the iliac wings, and then sacrum, and then as we go down even further, this would be where we would do our gender, and we've got a femur right here, but we're gonna start up top. So baby is in here. Well, he's a little bit more on his side than that, like that. Okay, so I typically start at the head. So here's our head over here. Come on, baby. We want to get that midline falx as perpendicular as we can, but again, with these eggs, it's a little bit difficult. So in these, there is a midline falx and a cisterna magna. Come on, buddy. I need to be real careful. Egg. Yeah, the standoff pads can definitely help. But we're worried about that. Okay, so here's my. Let's drop out. Here's my cerebellum midline falx. I want to see some cisterna magna. Oh, I'm reefing on this poor guy. Cisterna magna. It just looks like a little anechoic thing. And then there's not really much thalamus going on these bad boys. This is like the worst of the worst. Baby, you're killing me, baby. Was somebody grabbing that standoff pad on the somewhere, wherever it went? Thank you very much. No problem. I'm not allowed to touch it. Okay, now we're kind of in luck here. Okay. Much better, much better. Okay, so we should have, so this is our fake cisterna magna. So baby's pointing anterior is here. Thalamus is kind of this hypoechoic, and then if we go more inferior, our cerebellum is supposed to be this hypoechoic.
It's not cerebellum, it's
CST.
Cerebellum here. Oh, did I call this cerebellum? I'm sorry, CSP.
right, system magna. It's okay.
Of course I did, because, you know, I don't scan OB. So this is going to be kind of the best that we can, let me center a little bit, kind of the best that we can get. So when you guys are scanning these models, the midline falx isn't very nice. They didn't do a very nice job with it, but the CSP is going to be our landmark. The abnormally shaped thalamus is going to be our landmark, and not the cisterna magna. Okay, so we're going to hit our calc button, and it's going to bring up our menu. We're going to do a biparietal diameter. So where's my first caliper? Oh, I'm sliding all over this.
Outer.
Outer. And these are a little bit wide here and a little bit narrow here. Out in the real world, this is going to be a little bit more symmetrical. And I think about it kind of going through the thalamus. So kind of right through that thalamus. So outer to where? Where am I going?
Inner.
Sorry. Outer,
You
inner.
got me.
And then we can use the same image to do that head circumference. So again, I put my caliper either anterior or posterior, but I put my calipers there because it makes opening my ellipse a little easier. And if you have a real fetus, you can use that midline falx to kind of determine, okay, I'm going to go continuous with the midline falx for my calipers. Versus that way you'll know that you're not too lateral, right or left. So you kind of follow that midline falx. And we're going to go to the anterior. We're going to shrink this bad boy down. And you could spend the rest of your life getting this perfect, right? So the key is you want a similar amount of, so see how we're over measured here? We have a similar amount of under measured here. We want to make sure that there's kind of some symmetry to the amount that we're under measuring and over measuring. So you just do it to the best of your ability. So then there's our head circumference by parietal diameter. Let's get this guy out of the way.
You want 2 or 3?
Where the protocol?
I think I have 2 on there. Okay. Then, so here we are.
Doing any annotation?
No, because we're measuring, so when we measure, it brings up the annotation. But if we're doing, like when we do fetal heart rate or we do anything else, extremities, then we will have to annotate. But these are nice just because it will say, biparietal diameter, here's your measurement. Okay, so I'm in baby's head right now, coming down into, thank you very much. Coming down in, so I'm in C-spine right here. Coming into those clavicles, we're going into the abdomen. We could do that 4-chamber heart at this point. Kind of get our 4-chamber heart going. So let's go ahead and image with use our zoomies. Like this one we would have to annotate.
Okay.
So 4-chamber heart, look at a little defective there.
It's sweet.
Yeah, we've got a very patent foramen ovale. So then we would do 4-chamber. Oops, hey, where are you? So 4-chamber. So that we would have to annotate. And then you could do your M mode in here. And let's get the text over here. Let's go back to where we were. Switch open. And then we're going to cruise down. We're going to look for the anechoic stomach. So here he is. Now, I want to get my rib symmetry correct. So I'm going to clockwise, counterclockwise, until I have some symmetry with those. Oops, I'm back up the heart. till I have some symmetry in that rib space. Okay, so here we go. Oh, one thing I should note for you guys too, we think of the abdomen as being very, very round, and most of the kind of textbook images that you see it's round, but sometimes the fetuses will have their knees to their chests, and so it will make it a little bit squished, especially in later gestations, so you just kind of do your best. And then I have my machine at work that tries to help me, so I'll say, hey, I want to measure this, and it's like, here, it's right here. I'm like, no, what are you doing? Or like, here's femur length. Oh, here it is up here. I'm like, there's not even a femur there. What are we even doing? So sometimes the machines are kind of not so helpful. So abdominal circumference, again, I do my anterior, posterior calipers first. Just makes my ellipse opening and closing a little bit easier. So I'm getting that skin line. Widening out just a little bit more. Again, so we've got a little bit of over measure here, a little bit of under measure here, pretty much similar in amount. So we'll go ahead and call that. So here we are back at the chest. And baby's in here, like I showed you guys, so we're kind of cruising. We've cruised from the head down to those clavicles, C-spine, we got our forechamber. Now we're gonna go down even further for our abdominal circumference and all the way down past our renals to start getting our femurs. So all the way down past our renals. There's not really renals in here. Here is your landmark going into urinary bladder land. There's that urinary bladder. This is the neighborhood that we would be looking for our gender in. There it is. And so see how it's a single echogenic foci, whereas the distal extremity over here, tib fib, has two. And so when in doubt, just go transverse on it. If you have two, you're in a distal extremity. So then we're going to lengthen this bad boy out. We want them perpendicular to our beams. We have to slide over on mom a little bit. And clockwise, counterclockwise to determine his overall length. We're looking pretty good, maybe right in here. Pointer, femur length. So one end to the other end.
We don't need to find out it's left or right, just
so you will when you do your extremities, so you'll know what's going on when you start doing your extremities. But in this case, it would be, because he's laying like this, it would be his right side. Oh, he's got webbed hands, poor kid. Oh, that's terrible. I didn't notice that. Okay, so now humerus length on this machine. To find your humerus length, we have to go to advanced OB settings, and then it will bring up, remember how you talked about having to measure all those goofy things? So ulna, tib, fib, all that, so that will go to this one.
got it.
And so we're gonna end up doing our humerus, so we're gonna go back upstairs in baby, so we're kind of scanning inferior on mom, superior on baby. There we are at the stomach, there we are at that chest again, coming into the clavicles. So if we're at C-spine and clavicles, and I go just inferior, see how I have that solitary echogenic dot, versus, let's find the other, where's your other part of your arm? Versus if I go to the lower arm, I'm gonna have two. So just making sure that you're only seeing one. We're gonna lengthen that bad, running out of gel here. We're gonna lengthen that bad boy out. And this one is not as, you won't see this quite as clearly. You'll be able to see the superior portion of the humerus a little bit better in real patients. Optimize, optimize. All right, we're nice and perpendicular to our beam. Elongate it out. Pointer, so we're gonna go humerus. Distal portion to the proximal portion. This is the fake clavicle, so I'm just gonna ignore that. And we're just gonna go to that superior portion of the humerus. So that's our basics for the biometry. Okay, so that being said, same as we had for our first trimester, we're gonna have a report page. So we're gonna go into report, we're in the report.
Wait, so that's all you did?
Yeah, and then you repeat it again. So it's like 2 sets.
Oh, so we don't have like heart rate?
Well, no.
No, I mean
Oh,
for the
for the
image
code-
critique.
Yes, but you're gonna do it on a real patient.
Yeah, so we're doing it.
Yes, so the images that we had up earlier.
The critique.
Yeah.
Oh, Cindy.
Cindy.
Okay, give me one. Yeah, please remind me again.
Quick question about the doing them twice. Do you do like each
I'll
measurement
do head,
while you're there?
head,
Okay.
that part,
Got it.
Abdominal, just on there. Why, like,
Sure.
zip and then things.
All over again. Yeah.
Okay, so this is our short report. So this is going to give us the adjusted ultrasound age. So 25 weeks, 1 day. Based on LMP, I should be, me, whoever this is, should be 28 weeks, 1 day. LMP backtracked it for us on our machine, so October 5th. Estimated date of delivery, 7/12. Oh, that's me. Actual delivery is going to be 8/2. And then this gives us these kind of ratios, and don't worry about these for us. When you get into an MFM, some people use them, some people don't. And then here's our estimated fetal weight. And we go by grams on our worksheets, but I usually tell my patients pounds. I think it's like, hey, you got a 5 gram baby. And they're like, how many Oreos is that? I don't know. And so 729 grams plus or minus 106. And then I would tell the patient, oh, you're at 1 pound, 10 ounce. And then we can go, so we'll take an image of this. And then we'll go down to page 2. And it's going to average our, so all the measurements, we only took one set, but all of our measurements get averaged together the same way that we had for our first tries. So our BPD is 6 centimeters, which gives us 24 and 4. And before I leave the room, before I'm done scanning, I always go through here and make sure that I didn't screw up or nothing's abnormal. Just in, like, oh, do I have any discordance? Do I need to do something else? And then our extras will come up at the bottom. So we'll take that. And then don't forget, you can edit these. And if I go to the long report, it's not editable, but it will show me the specific measurements that I did. So it will average all of this together. So if you can see like, oh, I had 6, 6, 7.5, 6, 6. So I'm like, oh, I need to go in and fix that one measurement. So you can see exactly what you've done. And if you do screw up, you go to edit report, and I need to take out that erroneous measurement, I can go in here and edit. Or if you measure out of your package, you're like, oh, humerus, doot, 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 and you're like, I forgot to put it in the package, then you can add it in here. And that way it will be part of your average. It will revise the calculation and be part of your average. Any questions on that? Okay, how are you guys feeling?
What kind of difference allowed here? For first trimester, you said 1 day is good enough, like difference.
So for us, it depends. So as you go, so for us as a general rule at my work, we use a week for second tries and 2 weeks for third tries. But I'm sure Brianne, who actually does MFM stuff, has a more specific value associated with that. Yeah, my work, we are.
Can you say for the biometry limited that we're getting critiqued on, could you tell us everything that you want from us?
It's in the very first part of, remind me and I'll bring it up.
Okay.
But Masha will know. But yeah, well, because when she texted me, I thought she was talking about the eggs, and it didn't occur to me that she was talking about a real patient. So she's like, do I do cervix? I'm like, nah, I don't even have a cervix. Like, what's going on here?
Gotcha.
And so she screwed up.
Placenta, cervix, heart rate, and then biometry.
Then biometry, yeah. And 4-chamber. 4-chamber.
Isn't
Okay,
that
so
part of
cities.
biometry, though? That we don't measure it, so it's not considered biometry, the 4-chamber.
The 4-chamber is not considered biometry, but we evaluate it just for any abnormalities, just because we're there. Okay. Oh, and that's the other thing. If I have a patient for an abdomen or not necessarily a thyroid, but something where I'm down in this neighborhood and she's pregnant, I will always get a fetal heart rate. So don't be like, thyroid patient, let me get your fetal heart rate. But if we're doing right upper quadrant, renal, something like that, I'll always get a fetal heart rate. So cine clips. All right. Let's do.